Well, welcome everyone. Welcome to the semifinal round of the UCSF Digital Health Awards for our second annual show. We are absolutely blessed with two moderators here that are, industry thought leaders and more. We're going to have fun for the next 45 minutes, but the real idea is to congratulate these companies and to let them shine. I'm going to kick it off with a video, and then after the video, we'll get into the presentation.
Welcome to the second annual UCSF Digital Health Awards 2020, the Academy Awards of Digital Health, where we honor the best technologies that are defining and leading the digital health revolution.
We want to improve healthcare, so we're really excited to be part of this wonderful evening.
Collaborators include the top healthcare incubators, accelerators, and venture capitalists across America, featuring the top 100 digital health innovators in the country selected from over 1,000 entries, 15 curated award categories, hundreds of judges selected from the healthcare community, healthcare industry thought leaders, thousands of online attendees, and dozens of virtual events, culminating in the September 23rd finals, honoring those who are reshaping the industry and making a difference in the COVID pandemic.
Join me, Twee Vu, as we honor the role digital healthcare plays in rewriting the future of health.
And the UCSF Digital Health Awards is narrating that future. Join us on September 23rd at 6 p.m. Pacific time for a 90-minute celebration as we honor these winners, changing the future of healthcare.
Well, hello, everyone. So welcome again. My name is Mark Goldstein, and I am the chairman of UCSF Health Hub. And we're here for our category called Consumer Prevention. We are down to the last 4 companies we had over 1,000 companies apply, 750 were accepted, and we're down to the last 4 in the consumer prevention category, which is one of the biggest categories of them all. Let's talk about our agenda today. I'm going to make some introductions. We have 2 incredible moderators that are going to be plugging away with questions. We're going to, the companies are going to each spend 3 to 4 minutes reviewing their application, talking about why they're important, why they're different, and what matters. These are prepared discussions. From there, we then go to a second half of the 45-minute session, which is more of a roundtable. And the roundtable is we have 3 questions that we have not shared with the companies that are basically, we're going to give the companies 30 seconds each to answer each of these questions. If there's time at the end, we're going to ask for questions from the audience, and then we'll close it. We want to really keep to 45 minutes. Again, I'm the founder of UCSF Health Hub. Health Hub is a nonprofit. We're UCSF's innovation arm. We are funded by the venture capital community, and we are really excited about helping companies scale and grow. Focus on digital health companies and really companies, any company in digital therapeutics and increasingly all forms of healthcare. My day job is I'm a venture capitalist at a firm called Builders. So I invest in digital health companies, and I love this stuff, and it's why I'm doing it. A little bit more about Health Hub. We are now 20 venture firms fund us. We're based in Mission Bay. Typically, we have this event on campus in Mission Bay, which we did last year. Obviously, we could not this year, so we're going to 100% online. We're just producing the event, but we're really out here working with a lot of other great companies, 2 of which are represented by my other 2 moderators. So we get into this today. I want to just take a step back and thank our sponsors. We have some great sponsors for the Health Awards event. Big sponsor is NTT, the huge Japanese telecommunication company. Wilson Sonsini, they don't need an introduction. Silicon Valley Bank. Livongo is a sponsor. Novartis is a sponsor. And all of these venture firms that you see on the list are super important sponsors. We couldn't do it without them, and they're keeping the lights on at night, and we thank them all. I'm going to kick this off and first introduce Unity. Unity is the co-founder of Startup Health. Startup Health probably goes without, I don't need to explain what Startup Health does. They've really set the lead in digital health. It came out a few years before anyone could even spell digital health. They have a great event at JPM. This year, I imagine they'll go online because there is no JPM. But they have this concept of healthcare transformers, and Unity will talk a little bit more about it. I've known Unity for many, many years in our .com days. So he knows how to, get around. And I'll go back to Unity in a second, we have Steve Barsh, and Steve is a managing partner at DreamIt Ventures. DreamIt is based outside of Philadelphia. DreamIt this is 2 years straight, and between Startup Health and DreamIt and MedTech Ventures, there are more companies that come from DreamIt Ventures and these two other entities than anywhere else. DreamIt Ventures is a great venture firm, a great accelerator, and they work really closely with their companies to get them live. He's also a Penn grad, so I go red and blue with him. And but we've got three great guys. And Unity, you want to say a few more things?
Sure. Thanks, Mark. First of all, it's such an honor to be here, and thank you and the UCSF Health Hub for really recognizing digital health entrepreneurs with the Digital Health Awards. I mean, it's such a challenge to reinvent the future of health and healthcare. So just thank you for kind of shining a spotlight. With Startup Health, as you said, we're really trying to build a global army of health transformers to solve the biggest health challenges of our time. And this particular award, consumer prevention, is, I think, really, really significant. If you just look at the two words, consumer, how do we put everyday people in control as the CEOs of their own health, and prevention, how do we transform the future of health so it's about staying well and staying healthy throughout your life. So really, really excited to showcase 4 amazing companies today. We'll get started here in a minute, but Steve, let me turn it over to you to say a word.
Thank you, Unity. Thank you, Mark. Steve Barsh from DreamIt Ventures. Very excited to be here. Thank you for having this be a part of your great event. DreamIt is a venture firm. We also do these pre-investment programs in both health tech and secure tech. Health tech is largely both digital health, like we're talking about today, and some of the other companies too, which is medical devices. So we do kind of both, and we kind of operate in the pre-Series A space. I think consumer prevention is really interesting to DreamIt and to me personally. And the reason why is it is so freaking incredibly difficult. But prevention, an ounce of prevention is better than the cure kind of thing. That's easier said than done. Human behavior, what does it take 30 years of advertising to people to wear a seatbelt so you don't get killed in a car accident, or to, not put on weight and get off weight. So prevention is incredibly difficult. We've seen several startups over the last couple of years that are able to basically hack the way people act and think. It's very, very difficult, but when we see breakthroughs, it's tremendously exciting. Prevention is great. It's just really hard. And it takes a startup to come up with something really clever and out of box to figure out how to get people to do the right thing, because so often they don't. So really excited about the category.
That's great. Well, I'm going to, this is probably one of my last times talking. Let's talk about how we got here. This is one of 15 categories, consumer prevention. We have spent the last 3 months whittling through many, many, many submissions, working with tons of different companies and getting to this point in time. It's a labor of love, but we signed up and we're doing it. Again, 750 submissions, 3 rounds. We've gone through a first round, a quarterfinal round, and now this is the semifinal round. 250 judges. These are judges that come from, they're practicing at UCSF, they're clinicians, they're doctors, they're professors, they're venture capitalists, they're folks like Steve and Unity. They're people involved in both of those firms. They are, they're other VCs. They are running healthcare organizations. They're clinicians and doctors around the country, and they're just simply folks that have raised their hand and says, hey, I know digital health. And I think I've got a good point of view, and I can help you basically pick great companies. So our judging criteria, how did we get here? This second round was different from the first round. The first round, we really focused on validation and market traction predominantly, because we wanted to make sure that the companies that were getting into this quarterfinals round really had products in market. They really were making a difference. So now that we've gone through this second round, we're able to sort of even drill down even more. So they're 50 points, and there were 10 points given for each of these categories. 10 points was given through the, what's the value of to the customers that the company was providing? How big a deal is this? And everything is on a 1 to 10 scale. Level of innovation. Was this company, was this product really off the charts? Is this really different? Is this award winning, or is this me too? Validation remains important. We want to make sure you were touching, tens of thousands, millions of people, making a difference. More validation basically proves more, that something's going on and it seems right. Traction, market traction, obviously important, and level of differentiation. And at this point, that's really important. We're going to give the 4 companies today further opportunity to really, tease out how they're different, why they're just the best at what they do, and hopefully you'll get a good perspective. So this is the Best Consumer Prevention Company Award. And really with that, I'm going to turn it over to you guys to divide and conquer. And, basically here we're going to introduce the companies, and each company will get a slide. But Steve, you need to take it away.
Yeah, so why don't we just jump right into the good stuff here. We got 4 amazing companies and solutions to learn about. We're going to start with Dr. David Utley from Carrot. Why don't you've each got 4 minutes, and then we'll do some follow-up questions later.
Good.
David?
And before we do that, and this is my bad, again, these were the 4 questions that we asked the companies to answer. Right. What's unique? What's your user journey, validation, and where are you going to be? Okay.
Hey, great. Thanks, guys. I'm David Utley. I'm the CEO at Carrot. Our product pivot is designed, it's a digital solution to help people quit tobacco, all forms at scale. And what's really unique about the space, because Unity said it a minute ago with prevention, you may not know it, but tobacco kills 7 million people a year globally out of 1 billion users. That's 6747 jets that crash every day full of people that smoke that don't have to die. And when I started the company 5 years ago, I was a head and neck cancer surgeon at Stanford in my first career. I'm thinking, all right, if the US Preventative Services Task Force ranks tobacco cessation in the US as the highest grade A, just like colon rectal cancer screening, if the ACA mandates that every employer and health plan provides cessation services twice a year for free, if it's paid for, then why is the best solution telephonic quit coaching, which is like telephone based and some over-the-counter nicotine replacement therapy for a disease state that has a 55% mortality rate? So we designed, we followed the paths of some other greats in the space like Glenn Tolman at Livongo. We took the proven health and human services practice guideline, we digitized it. We provide in this digital solution, FDA-approved pharmacotherapy, trained health and wellness coaching that's been shown to help people quit all forms of tobacco, community, supportive community, behavioral change. And then as you see on the slide, we're the first in the market. I was thinking back when we started the company, I thought, wow, we lose this many lives a year and this many dollars in the US. And yet the last drug was varenicline in 2006 for the #1 cause of death in the United States. And there's never been a medical device. So we have to change that. And so that was the impetus behind, getting the company started. One of the most unique things about the user journey is that most quit programs use scare tactics to scare people into quitting. And unfortunately it doesn't work. So if you look at PSAs with FDA, you'll see people with tracheotomies or stomas, lung cancer resections, MIs, and early mortality. And those tactics don't work. So the voice of our product, which we market right now in the channels to the enterprise and to large health plans, is tobacco cessation is scary. Most people try to quit 20 times and fail. And we're much more about making progress, joining a program. It's a 1-year program, unlimited access to your coach and pharma and to the device, so that the failure mystique is very low. So we had to, like any preventive service, like flu vaccines, you got to get people in the program. You can't make it scary. Or colorectal cancer screening, you got to make it really, really receptive. So Pivot is very receptive to all people of all stages of change. The validation, we've run about 15 clinical trials, 3 are published. The longest term follow-up we have, it has a 31% quit rate using intention to treat analyses. That's people that have not had a puff of a source of tobacco for the last month at 6 months follow-up. And so that's called the point prevalence of abstinence. And then, you know, short on time, besides the validation, you've asked, what does this look like in 5 years? So I was a doc for 11 years at Stanford. I never had a product or a solution that I could write a prescription for, or some sort of a medical device for my folks that had head and neck cancers related to tobacco use or in the ER or primary care. So my dream over the next 5 years, because it takes time, is that every healthcare encounter, every point of care, digital, in-person, ER, primary care, OB, pediatrics, the person that uses tobacco, which is going up now with e-cigarettes, gets an evidence-based solution like Pivot delivered to them at no cost to them through their health plan or through their employer. That's a dream. It's the only way we're going to make a dent in this problem that affects over 40 million people.
Thank you, David. Let's move to Podimetrics. John Bloom.
I hope you guys can hear me all right. By the way, just thrilled to be here with such amazing company. It's really inspiring to see it with just all the work that everyone has done. Can you guys hear me okay? Am I coming through?
Mm-hmm. Mm-hmm. Yep.
Perfect. Okay. So consumer prevention track, you know, we focus on diabetic amputations, you know, unlike, you know, other like sort of big parts, heart disease or diabetes as a whole or COPD. This is a condition that is largely completely preventable, and we're doing it in a way that has never been done before. And one should never have to lose a limb to diabetes. We have to keep them on their own feet to have an independent life. And I was given four questions. I'll try to run through them in sequence and get up to the next amazing company. But why are we unique, or what does our solution do that's unique? You know, Good to Great was an interesting book to come back to. It talked about what can you be best at in the world. And I'd say we're literally the world leader in patient engagement for this very complex patient that allows us to drive change and drive for outcomes. Today, we're now the leading solution to help prevent the most debilitating and costly complication of diabetes, the lower extremity amputation. We have cutting edge tech. It's a smart mat that goes into the home that can detect 97% of foot ulcers, this wound that precedes amputations over 5 weeks before they present clinically. We combine that with virtual care, nursing management services to provide simple, targeted, and timely interventions. And we really tailored our solution to reach the patients who are most vulnerable, this patient population who's largely, I think, ignored by the system, those that they don't often even have access to clinics. It's the same patient that we see as at risk of COVID-19. They tend to be older Americans, have multiple comorbidities, predominantly in underserved and lower income populations. For example, Black Americans are over 3 times more likely to get an amputation than white Americans, and they lack access to proper preventative care that most of us take for granted, right? With true engagement, though, you can do great things. And what does the patient journey look like, or the user journey? JAMA laid out a whopper last month. In the recent paper, they said 41% of Medicare beneficiaries don't have either a cellular or a smartphone or a computer with access to the internet. Almost half the patients don't have this technology. It's not like you can throw tech at them and then expect results. You know, for the patient, for us, we provide them this device that's cellular enabled. Just press on. You never have to press any other button. There's no pairing with Wi-Fi or a smartphone. They step on it for 20 seconds a day and go on with the rest of their life. That's all we need them to do. You have a beautiful cue right when you get out of bed to get this habit to go. On the doctor side, it's very, very similar. They're going to write for the system, but then we take over. We're going to mail them the system. We're going to train them on how to use it. We do all the monitoring. Really, there's no dashboards to monitor. There's no extra staffing needed to be looking at charts. They see the patients when we need to escalate them. And usually at that point, it's callus, something that needs to be debrided to ultimately prevent the wound from occurring. We're seeing really amazing results in the VA. I'll share with that in a second. But equally important, we're starting to see it now repeatable in different healthcare systems and environments. How do you differentiate yourself against the others and even the people in our space? You know, one of the greatest challenges of telehealth is reaching the very patients who need it most. This problem, this gap we have with telehealth, you know, and the challenges of getting it to this patient population is as common as diabetes is. The patient at risk for diabetic foot complications have been previously sort of left out by tech and the system. And from the very beginning, we knew we had to design it for that very population. Again, no pairing, 20 seconds. You can sit when you use it, stand when you use it. You can already have had one major amputation. You only need one foot to use it, whether you have bad vision or bad hearing. It had to work in all of those use cases. And at its very core is just focusing on the issues that are patients that are most vulnerable, transportation issues, et cetera. Why should we ultimately win? Diabetic amputations are one of the greatest markers of poor quality healthcare we have. It was per the Kaiser Family Foundation. A 2017 New England Journal article said that a third of the cost of diabetes is linked to complications of the lower extremity. This is a massive hit to our budget. And these populations are not only expensive, but they've just been largely ignored by the system. It's not that our system is incrementally better. It's just diabetic complications like this shouldn't happen anymore, period. It's Civil War medicine. Back when I was an anesthesiologist, we spent whole days doing nothing but amputations, and that shouldn't happen with today's technology. Just some quick stats to close out. We had a paper in 2017 that said 97% of foot ulcers we can detect over 5 weeks before they happen. In the VA, very challenging cohort, 70% of our patients were still fully engaged at the end of 1 year. And as a result, early quality improvement data came out that showed that we had essentially eliminated all major amputations and eliminated all but a couple of the diabetic foot-related hospitalizations, which is 2/3 of that cost that I mentioned. These patients deserve the opportunity to live independent lives on their own feet. No one should lose a limb to diabetes. It's our mom, it's our dad, and it has to stop.
Great.
Thank you for your time.
Thank you so much. Next one, I believe, is Dexcom. We got Matt Dolan.
Hey there, thanks Unity, and hope you can hear me. Appreciate everybody for letting us present today. We're also honored to be named in part of this category among a number of great companies and technologies. And somewhat what you just heard, we're addressing a massive problem. You've heard the stats on diabetes for sure. There's more than 450 million folks worldwide afflicted with it, and more than a third of the US with either diabetes or pre-diabetes. So I'll give you a little lens into what we're up to from a consumer prevention perspective. The last 2 decades, although we've been around a while, we still feel like a startup. Our team's been working almost exclusively on creating best-in-class continuous glucose monitors, or CGMs. These are sensors that eliminate the need to take those painful blood-based finger sticks to acquire glucose data. And because of that, we can deliver a glucose level every 5 minutes to a smartphone or a smartwatch or some other convenient area. And this really gives you a much more comprehensive picture of your glycemic health. 288 data points each day, and it can warn you if you're going too high or too low. So if you think about what this can tell you, in any person, not just people with diabetes, when I wear it, I can tell what that meal just did to my glucose metabolism. If you're on meds, whether those medications are performing optimally. Did that walk I just took help me get the glucose back in range? How did my glucose variability overnight impact my energy the next day? This is incredibly powerful data that we're serving up. In the second topic around the patient journey, historically, we've offered our sensor through the traditional medical channels, reimbursed through the pharmacy and so on. But because the value proposition I just alluded to, we're beginning to see much broader interest in the technology in the type 2 space, along with prediabetes, obesity, and even wellness and fitness. And we know how important diabetes and obesity can be, specifically from a morbidity perspective. You can look at what we just witnessed during COVID, or what we're witnessing during COVID, where these folks are experiencing significantly higher risk in their outcomes as a result of these conditions. So this dynamic has really opened up new avenues for our go-to-market approach and how the patient accesses the product. We're starting to see programs where we can get it in the hands of a patient at either little or no out-of-pocket costs through their employers or their health plans through these complete diabetes management programs. We have collaborations with folks like United Health Group, which has a type 2 program, health systems like Intermountain Healthcare, where we're seeing great clinical outcomes, which is of course important, but also very high user engagement and big economic benefits. In one case, we saw savings of over $5,000 per person per year. So this really highlights how this is transforming us into more of a consumer type of play within healthcare, where you've got to have an experience that's attractive and also address that glaring financial burden that diabetes has delivered to our broader healthcare system. And importantly, the patient feels this too. The feedback we've generated so far really emphasizes that patients feel empowered when they use this technology. In terms of differentiation, I think I'd rather talk about, the opportunity we see. I think there's a ton of great solutions out here. But we feel very fortunate that there's really two main themes that have evolved for us as a company and are very unique. First, it's just tremendous to see what has gone on with our technology to date with what we offer today, meaning we haven't adapted to expand these new opportunities, but we are starting to impact these large and important populations. There's a growing body of evidence around the use of CGM in all people with diabetes, both in those key diabetes specific indicators like hemoglobin A1C, but as well as insights that once you start to treat that underlying condition, you begin to see improvements in a number of the common comorbidities like hypertension and weight loss, which is incredibly powerful. And most importantly,
got about 10 more seconds here.
Okay. Patients are embracing the technology. One recently said it perfectly. I took control. My second theme to close us out is when you consider that 2/3 of the people with prediabetes will develop type 2, we see an opportunity to really provide a solution that can stop them on this path that is often viewed as, unfortunately, as inevitable. So we see a world where we can ultimately flip the script from just a treatment to ultimately playing a major role in prevention.
All right, thank you. So the fourth and final one presenting today, surgical theater. Sonny, take it away. We got 3 to 4 minutes max.
All right, no problem. Thanks, Unity. Thanks for having me here. So surgical theater, at the heart of what we do, we're a company that is based in flight simulation technology. We take medical scans that are patient specific. So we're unique to each and every patient. We take their MRI scans, CT scans, what have you, anything that they get for imaging, and we reconstruct a 360-degree virtual reality model based off of those scans so that when they walk into a consultation, they see things and they see their anatomy and their surgical plan the way that they actually understand it. And this is unique because right now, the way consultations are being done, physicians are using 2D black and white MRI scans where left is right, right is left, this shade of gray is good, this shade of gray is bad. And they've spent a large amount of their medical career learning, how to reconstruct that image in their mind's eye. And we're able to take that and translate that into something that's digestible for the patient in a matter of moments using our software. What the patient journey looks like is when they walk into a hospital or medical center, they're able to provide either a CD or we've got imaging from the hospital, and we reconstruct this for not only their initial consultation, but the technology and the model is then used with the surgeons for preoperative planning in the operating room. And then there's additional imaging that gets done post-operatively. And then we can actually fuse in this post-operative imaging. So when patients come back for not just their first consultation, but their post-operative consultation, they can see the difference that the procedure has made and how difficult it was to accomplish, and maybe some follow-ups that may need to happen and the reason why. And then taking it a step further, we're actually also providing videos, whether those are 2D videos or 360 VR videos, for the patients to take home to family members, where you can imagine as a patient, when you walk into a consultation room and you need to have surgery, there's only so much you can grasp at that moment. So by being able to have something that you can take home, that you can understand and share with your family members is extremely important. The way that we're also differentiated is actually how broad the utility is for this product. And what I mean by that is often in medicine, because of restrictions in a number of different reasons, you have to focus on a specific specialty, a specific area, and a specific procedure. What we're able to do is any area that requires medical scans, so whether that's brain cancer, cardiac procedures, lung cancer, liver cancer, we're able to provide value in all of these. So we're providing value in not just one area, but multiple areas across the healthcare continuum. And then we're also providing great value when it comes to the continuum of knowledge and kind of the different parties that are at play. So for example, we have pediatric patients that walk in, and in order for them to understand their physician, they can look at their own face and their own model and understand what the procedure is. And then you have veteran surgeons who've been operating, and they're getting value from this. So in the operating room for this surgical plan. So the spectrum of utility for this product, not only between the people that are involved, but actually the whole healthcare spectrum of the patient and their journey is unique. And where I see us in 5 years, really, we're developing so fast. That's a really tough question for us to answer. But some of our developments in the pipeline include not just virtual reality, but augmented reality, where we've already developed from taking it to 2D to VR. And then we realized that, you know what, putting on a VR headset is still somewhat, isolating for the patients because they can see it and they take it off to talk to their physician. But what we wanted to do is we wanted to make them, we wanted to allow them to be able to see this model that we create for them, but also see their family and the surgeon at the same time. So we're now developing augmented reality models where you can have multiple people in VR and in AR headsets, augmented reality, and they can see the model along with their physician. And now also, this is really accelerated due to COVID, but with telemedicine as well, as computing power gets stronger across the board, we're able to take these models and show them at patient houses and show them at home as well, where they can now view these on their screens and at home and get that experience.
Coming up on time here. First of all, thanks to all the presenters. These were all 4 amazing solutions. It's amazing to see the diversity in the solutions here. Steve, I'll have you kind of help guide the Q&A here. We've got about 15 minutes here, but just Steve, while you're getting set up, and Sonny, to jump on to something you mentioned post-COVID or COVID, how it's accelerated. A question came in via the Q&A chat here. For each of you, how has the pandemic, or how do you believe post-COVID is going to affect or accelerate what you're doing? And then Steve, I'll kind of turn it over to you to guide the rest of the name.
Thanks you. So one way that it's accelerated is that we need to be able to bring our solution to customers where when they're not going into hospitals, our solution is focused on when they go in and they can have this great solution, but we're also integrating with telemedicine platforms so that physicians can be at their system, they can share their screen and they can see this technology with the patient. And what we're also developing is making these models and these videos more accessible and able to easily be sent to patients at their home, so they don't need to see this just at the hospital institution, but they can access it everywhere outside of the hospital.
Cool. Did you want everybody to answer that question, Unity?
Let's keep it going. We've got limited time here, so why don't we dig into a few different topics, Steve?
So, and and just maybe Mark can verify if you know Unity, these are questions from us right now, not from the audience. Correct? Yeah,
you're basically going to plug each, 30-second answers from the companies, and these were the 3 set of questions. And I think we're already hitting on the 3rd one. How is COVID shining the light on what you do? Why is what you're doing? How are you changing the status quo? What's the old way? What's the new way? And why are you so important? And then why are you $1 trillion problems? I hope everyone should be focusing on $1 trillion problem.
Steve, do you want us to finish number 3 since you started there?
Sure. And then Mark, are we able to ask our own kind of like freestyle questions?
You guys are the boss. Do your thing.
Unity, is that okay? I just have come to follow up. Okay, thank you.
Perfect.
So first question is for Carrot. Can you, just a couple of quick questions I want to know. Are you largely selling on a PMPM basis? Like, is it an employee benefit? Because we've seen a lot of challenges for companies when you do that model, but which is it? Oh, is it on the healthcare plan, or is it PMPM as an employee benefit? I'm just kind of curious.
We're charging per subscription for 12 months under codes with our health plans for 12 months, or under a benefit for the employees and the self-insured employers. We don't believe in the PEPM thing. We got to deliver on what we say we'll deliver on, which is engagement and quit rates with an evidence-based solution. We have a couple clients that want to go partly at risk, so we have an enrollment fee that's factored in, and then we have a large payout for successful quit and validation of quit with CO testing.
Okay, cool. And I love the at-risk model because it's the classic thing. Our solution is great. Go at risk. No, I don't want to do that. So that's cool.
We're not afraid. We have a validated.
That's fine. That's awesome. It's awesome. One other quick question. I'll just keep going. Start up with just things. You said you have a 31% quit rate. I'm not that familiar with smoking cessation in rates. And that compares to, if I take a typical CBT approach in a telephonic coaching, what's their quit rate and durability versus yours?
Yeah, it's really across the board. And so, cold turkey, which is how 18 million people try to quit every year in the United States, has low single-digit quit rates at a year or even at 6 months. Some of the telephonic without pharma can have 10%. If you add pharma into the behavioral, the experts at UCSF call it about 20%. 30% is kind of top of the heap. And, our job is to continue to support those people lifelong. This is not a one and done. This is like diabetes. Everybody on the phone, we have 2 innovators that are focused on diabetes. We have to recognize that tobacco, is the major cause of type 2 diabetes and peripheral vascular disease. So we have to help these people, for as long as we can.
Got it. Unity, do you have questions for him and his model? Because I was going to next go to diabetes and diabetic foot ulcers.
Keep going through. Just give it a limited time. It's easier.
Okay, I'm going fast. So for Podimetrics, the diabetic foot ulcers, right? Question for you for DFUs. So you're sensing before it breaks through, right? So again, same type of thing. Are you doing a shared risk model? Like, I'm just kind of curious, what is that business model? Because a quick note, we believe strongly at DreamIt, you want to be innovative and clever in more than one axis to win as a startup. It's like a three-legged stool. It can't just be one thing. It usually takes multiple things. That's why I kind of probe around that. Could you just talk a little bit, shared risk, and is it PMPM or how are you doing your model?
Such a good question. So for us, it's a per engaged member per month charge. And if they're not, we just stop paying for it. We take at risk. You know, it's only if you're going to use it that you get the value, and that's only when we're going to charge.
Okay, cool. Great. Let me see if I had anything else for that. Shared risk. Okay, great. Got it. Okay. Next question. Just flying. I'm going to keep going, Unity. Okay. For next startup for Dexcom. Dexcom, love what you're doing. Love the brand. How do you though differentiate? There's, you know, a couple other competitors in the space, and it's not clear, you know, Freestyle and what Medtronic is doing. What do you see as your big, strong differentiators these days versus a couple of other people doing CGMs for outpatient?
Yeah, great question. We've, as I said, we've been exclusively focused on this single product for a very long time. And so we're known as the brand in CGM on a number of fronts. We focused on performance. We're the most accurate sensor by far. Convenience, the first to have no finger sticks, and ultimately cost. You mentioned earlier risk-based models, and certainly that was a part of my preamble, which is understanding our value proposition in bending the cost curve, bending that trend that is so detrimental to our healthcare system, ultimately potentially flattening it or even reversing it from an economic perspective. So those are the big focal points. Innovation-wise, we have our next gen coming out in the near future, which will be the smallest and most powerful on the market. And we're also investing heavily in software and analytics to really create that patient experience, as I mentioned earlier. So it's a very comprehensive approach.
Okay, cool. Last question for last company, and then I'll hand it back to Unity. For surgical theater, love the flight simulations analogy. The one question that kept running through my mind, and I'm sure you've talked about this a lot, is what changes? You know, I got it that, you know, things feel good, people feel better informed, but we see, you know, we've had, I don't know, 150 health tech companies go through DreamIt Health over the years. And the classic question we always think to ask is what changes and how do you change outcomes? Right? Like, and is there a measurable change? Can you address, you know, do you have an answer for that by chance?
Yeah, absolutely. I mean, we've done significant research in this area, and we've actually, one of the major changes is patient retention and reduction of outmigration. So not only are patients understanding their procedures better, but we've actually done studies that show that in certain areas, retention rate of patients increased by 50%. And then also, you know, that's tied to understanding HCAP scores, the types of questions where that patients the hospitals are reimbursed on have significantly increased, and reduction of outmigration. So when you have competitive areas, I'm a patient, I can go to this hospital or that hospital. I'm going and staying at the hospital where I get my 360 VR consult, and that ties to dollars to the hospital. And that also ties to understanding for the patient. So everyone wins in that scenario.
Cool, thanks. Unity, those are my follow-up questions.
Okay, Mark, it looks like we got 5 more minutes. Is that about right?
Yeah, go do, you know what to do with 5 minutes.
All right, we got this. This is great. So first of all, some great questions are coming in. So if anyone from the audience wants to ask questions, feel free to type them in and we'll try to get them in. You know, I'm curious, and this is really out to the whole group. You know, are each of you imagining going around the workflows of kind of the legacy systems, or how do you work within the current system? You know, to the first question here, what's your company doing to change the status quo? So much has changed even in the past 6 months in terms of behavior. How do you each look at the future? How are you thinking of kind of tapping into the systems that be in order to continue to scale and really make the best outcomes?
I can take a quick stab at it to start. Excuse me, I'll try to be brief on it. What had been status quo was still, we hope they do daily foot checks. We hope that we catch it when they happen to be in the clinic. And we know how good that is. That's called standard of care. That's why it's such a huge problem that it is today. we really needed a better way to do this. And we were fortunate. We'd been building the last 10 years to build this virtual infrastructure, all of our capabilities. So that was, when COVID hit, so we were immediately completely virtual, and we were able to address this challenge of where telehealth just sort of fails in this patient population. You really need to shift it from a one-to-one modality to one-to-many, monitoring whole populations simultaneously. And it's interesting, in the first half of this year, we grew 300% compared to last year. It was just well-timed for virtual care, and we were ready to go.
Yeah, on our side, on the Carrot side, if I were to tell you that you have a disease state that's got a 5-year survival of less than 40% tobacco use, and I'm going to treat you with 5 phone call visits from a telephone operator that is trained in telephonic coaching and give you a box of nicotine replacement therapy, you would see a gigantic mismatch. So if we spend 20% of our GDP on healthcare and 15% of that's on tobacco, you're like, why aren't we investing massive amounts of dollars into products and solutions that work, like, just to get to these patients at scale? So, we do have a large $1.4 trillion a year spent globally on tobacco use, and 60 disease states that are caused, including type 2 diabetes and peripheral vascular disease, that my partners here are innovating in to their benefit or their merit. So, we have got to just put every possible resource against the biggest elephant in the room, which is tobacco use globally, and do it with a warm, evidence-based, solution that people are going to try, and it's been proven to work.
Would you like me to answer as well? Or,
yeah, 30 seconds.
Yeah, absolutely. So the current status quo is that they're used, that in consultations, generic models are being used, black and white images are being used, and behavior is very difficult to change. So a big part of our approach, especially for surgeons who don't believe that they need to change the way that they're doing consultations, is that we allow the patients to tell the story, so they get to trial the system. And really, when patients react, and when they get a different reaction from the way that they've been seeing patients react over the past however many years, the patients really talk for the technology. Thank you.
You want me to wrap?
Yeah, why don't you wrap?
Real quick, we're embracing telemedicine. We're fortunate that our device is naturally connected to the cloud and everywhere else. And now we're really becoming the glue between your physician office visits. Diabetes management is incredibly inefficient. If you have a high A1C, you end up with another medication and so on. And the data we provide helps drive a lot of efficiency there. And so that's how our business model is naturally shifting.
Excellent. Well, we are right on time, Mark. I'll pass it back to you. First of all, I want to thank you, Steve. I want to thank all of the amazing presenters. We're looking forward to seeing everyone on the 23rd for the finals. Mark, I'll pass it back to you.
Well, it's Unity. Steve, great job. No surprise there. Everyone, if you haven't, tell your friends, tell your family, tell your neighbors to register for our award show. We're targeting 10,000 online attendees. We're going to have a lot of, really is going to be a celebration in a great way that everyone in the industry can kick back at home with that tequila and recognize that 2020 isn't a complete disaster, because at least we're at least doing everything we can to get out of it. Again, thank you everyone. And I'll let you go, 45 minutes. Again, Unity, Steve, always a pleasure. See you guys later.
Thanks everyone.
Thank you everyone.
Thanks, guys.
Thank you, everyone.